Hello, I'm Alma Schneider. I'm a licensed clinical social worker and the proud mother of 4 children, one of whom has Prader-Willi syndrome.
And I am Iris Miller. I'm a certified rehabilitation counselor and the proud mother of 2 children, one of whom has quadriplegic cerebral palsy and is nonverbal.
In this podcast, we discuss the uncensored truth about raising children with disabilities.
Prepare to laugh, cry, and hopefully learn something new.
This is 2 Moms, No Fluff.
Hello, everyone, and welcome to another episode of 2 Moms, No Fluff, our podcast that is funded by our nonprofit 1 in 6 Support. 1 in 6 Support is supporting families of children with disabilities, their communities, and organizations. And today, I'm so proud and happy to introduce our guest speaker, Dr. Carole Samango-Sprouse. Dr. Sprouse, we had the honor of having you here on another episode about the Focus Foundation. But for those who didn't hear that episode yet, would you mind introducing yourselves first?
Sure. I am Dr. Sprouse. I am a clinical professor at George Washington University and an adjunct associate professor at Florida International University. I am the science director and of the Focus Foundation, which is located in Davidsonville, Maryland. And we focus on children with X and Y chromosomal variations, dyslexia, and dyspraxia. People often ask us why we picked those 3, and our answer is X and Y chromosomal variations are markedly underidentified, and all of those children have a high incidence of dyslexia and dyspraxia. So we want parents to know who have kids with dyslexia or dyspraxia that we have great information that can help them if they are eager and willing to get the testing done, and also our knowledge and history on both dyslexia and dyspraxia.
Wow. So today we wanted to focus our conversation on dyslexia specifically. And I was wondering if you can give parents and our audience in general a bit of a description of the phenomenon. What is dyslexia and how do you recognize it in children and adults?
So dyslexia is very common, more common in boys than girls. And how we recognize it is disruption in reading function or a reading disorder. And so it can present in a variety of ways. You can see it as early signs of it as young as 4 and 5 years of age, children who can't rhyme, children who have difficulty recognizing letters or reverse letters, children who you say baby and they think it begins with a D or a T because there's phonemic dysfunction. And the way we recognize it when you get to school age is this is a bright child who now is struggling to read. So there's a discrepancy pattern. So we'll see children with IQs of 120 who are reading at the standard score of 100. That discrepancy is telling you that is dyslexia. So kids learn to read spontaneously, and it's a very natural process. As you see difficulties, one should always entertain dyslexia.
So for a parent in the house, kind of not attending school with their child, the way that they can put their finger on the phenomena is usually with reading, or are there any other, like in terms of the language development, things that they should be hyper attentive to?
Right. So the literature will tell us that some kids with dyslexia will have delayed speech. They could even be a little clumsy in motor skills. They could be a little delayed in fine motor skills. But there are many, many children who have dyslexia, who have normal speech patterns, good athletes, and no developmental disruption in fine motor skills. So I think the way to think about it is if in preschool, you're having a child who's having challenges recognizing his letters or the sound symbol. So he remembers D, but he can't remember what D says, or he's having trouble rhyming. And one of the very easiest presentations in preschool is these are kids who don't always like to be read to. So there's different kinds of dyslexia, whether you're auditory or visual or a combination. But for many of the kids, that have auditory, reading to them is not enjoyable, right? It's hard to store it. The other sign that we often talk about is word recall. So kids who struggle to remember words, this is the kiddo who may say, "What you say, mom? What you say?" And the idea is it's not that he's not smart. It's not that he's intellectually challenged. It's that that memory is not storing the words. And then he can't sort of respond to whatever you've told him or asked him. So I think for parents who are homeschooling, if we're thinking about that, the way you can identify it is typical kids between 5 and 6 years of age, often now earlier because of all the software and games that we have on computers, have letter recognition, begin to recognize whole words, stop, exit, common words they see all the time. If you have a child who's struggling with that, the question you should ask is, could it be dyslexia? And then the most equally important question is, what's the cause of the dyslexia? So we have different patterns, right? Genetics is sort of the key to everything today. I think about if you have a parent who had dyslexia, that parent's learning style becomes very valuable for your child's learning style. We think of our genetic disorders, extra X's and extra Y's, they are very common and they don't look any different. So you want to know if somebody says dyslexia, you want them to answer the question, how did this come to be?
I do want to ask you something that repeats itself in parents describing challenges with their children. Usually what I hear is that the challenges of reading are intertwined with challenges in writing and very messy handwriting, spelling mistakes, and changing of letters. Is this also a marker of dyslexia, or it's a totally unrelated phenomena?
No, it is a marker of dyslexia. But it's called, if you're having writing challenges, in other words, putting the letter to the paper, that's a form of dysgraphia. And it's very highly associated with dyslexia. So the child can tell you the letters, but then when he goes to put them on paper, he really struggles. And then the other idea of writing, what we call writing fluency, right? I ask you to tell me a story. So write on your paper what happened over the weekend. That's a very typical kindergarten journal idea. And the kids can't figure out how to do it. But if you say to them, tell me, like out loud, tell me what happened, they can go on and on and on. That's a dyslexia profile. It's certainly a risk factor. So they know what they want to say, but putting it on paper is hard. Hang on one second.
Take your time. This is interesting because the word dyslexia is much more commonly used, and dysgraphia seem to be kind of a hidden phenomena, although it's very common, I assume, for kids with dyslexia.
It is. It's very common. And the reason people dismiss it is it seems unimportant in this age of computers, but first grade, kindergarten, first grade, second grade, third grade, and even fourth grade, they're writing all the time. And so the dysgraphia can be very challenging and very frustrating for kids. And the idea is messy handwriting and spelling errors, teachers can get easily confused if they're not familiar with dyslexia to think that's an impairment that's affecting how smart or not smart the child is. And, there's very many famous people with dyslexia. I mean, they abound. And most of them, I would say the vast majority, are not only often intellectually intact, they can often be gifted in other areas, what we call sort of wraparound areas in music or in creative arts and a variety of things. But most important message for this, I think, is dyslexia is very responsive to treatment. Early identification pays off. The cause is very critical because there's other supports that you may get if you get to the cause. And to understand that the brain evolves over time. And so I have fathers and some mothers, but more typically men, because it's more common in boys, that will say, oh, yeah, I had trouble with reading. I forgot about that. And when you say to them, oh, when did it get better? They'll say, oh, around 20, 25. That's the last big growth of the frontal lobe. And so Some of them have very minimal, some still struggle. There's a wide spectrum of how it presents, but it is a disorder that, if not identified, can be quite intrusive in school.
So let's talk a little bit more about that. So once, let's say, the parents have the notion, the feeling that this child might be struggling and it might be dyslexia and or dysgraphia, what is the next step? What should parents do?
So parents should get an assessment, and it should be someone who's very familiar with the profile of dyslexia. So they're not always delayed, but they are typically discrepant from their IQ. So they can get a psychologist to do it. They could get a developmentalist. Some masters in special education also do dyslexia assessments. It's a very characteristic battery that looks at IQ, oral reading, depending on the age. So let's say it's a 7-year-old. Oral reading, silent reading. It will look at writing. And there's a variety of other things that need to be looked at if somebody's doing a good in-depth evaluation. But always, it's very important to have the IQ, because there are many kids, and girls in particular, who they're not delayed, but they're very bright and their reading is just average. And that struggle makes them very, very unhappy, and that leads to low self-esteem, and we all know where that leads.
Yeah. So in terms of using local services, is there a way for the parents to understand after an evaluation what is the cause or the root cause of the dyslexia, or that requires genetic testing?
Well, it certainly requires a conversation, at least with their pediatrician or with the person who gave the testing. I mean, they can go to the Focus Foundation website, and we have a questionnaire that says if you have 3 of these features, then it's reasonable to take this to your pediatrician, and testing is a reasonable assumption. I think that's one way. The other way is if you have a child who has developmental disruption, so he has dyslexia, perhaps he has dysgraphia, so trouble putting paper to pencil and using it well, and he's motorically clumsy, that is worth an evaluation by a variety of medical specialists. It could be genetics, it could be your pediatrician, could be a developmental pediatrician, and they will typically follow through with genetic testing is indicated, because we have clear-cut parameters of when it's important to look at the causation.
And then what can a family do to help the child and support their success in learning and just going about their life in a world that is so reading and writing based?
I know the world is very reading and writing. So it depends on the age of the child. If we're looking at, say, a 5-year-old to a 7-year-old, then, every public school system will have at-risk reading groups starting as young as kindergarten. Certainly parents can talk to their local elementary, their principal, their kindergarten teacher, first grade or second, and get that piece done once they have the documentation, right? Or they can ask the school to test for reading. And what I say to parents is, it's really important for you to respond to, he's a boy and boys do things later, because in reality, boys do well when they're developing normal. And so the kids who are struggling with reading are trying to tell us this dyslexia. There's computerized programs from as simple as apps. Reading.com is a really nice app that works on kids building sight vocabulary and paragraphs. There's specific computerized treatment programs. If you have a diagnosis of dyslexia in those early years, you can get specialized services from your public school. And all of those will pay off. But I think the really critical message is to understand, if the child is coming home saying things like, I'm dumb, I can't do this, you know how little kids are, they may say, I'm the dumbest kid in the class. That's telling you how quickly you need to support it, because that's the one thing we never want a child to think, right? Because all children come at their own rate and their own development, but they all have potential.
Right. I am assuming that we have a few parents listening to you right now, and they not only see their child in the description that you're giving, but also see themselves. And I'm wondering, what are the services and supports for adults that get a diagnosis as adults?
No, that's a great question, actually. So adults can be tested and can be determined whether they have dyslexia. And then there's a variety of services for them as well. There's reading tutors. It is different the older you get because it depends on how you approach it. So spelling becomes less of an issue once you're on a computer because we all know spell check is mostly reliable. You know, it has trouble with words that sound like theirs and there. There's always a problem. But you can get tutoring through centers. You can have, there's also adult programs that they can learn, like computerized programs they can participate in. The brain will change as long as you challenge it and treat it. And we know that based on the geriatric literature, that the more people use their brain, the more we develop dendrites, the more that leads to additional capacities. That's the wonderful thing about being a human. We're very resilient.
Yes, that's a nice and optimistic statement. I have
Always.
another question again with the component of dyslexia being mixed up with the attention deficit disorder. Can you also help a little bit between segregate? That's okay. And how we can help parents put their finger on the right cause or the right issue?
Yeah, so sorry if I'm working from home. We have a little bit of background noise here. So here's what happens. Kids with attention deficit disorder can have comorbidities that are a variety of developmental issues. So if the child has been diagnosed with ADHD, somebody then needs to look for what are the comorbidities. Is it also anxiety? Is it dyslexia? Is it dysgraphia? Because it is so commonly associated. And sometimes what happens is if you treat the underlying symptoms of the dyslexia and the dysgraphia with appropriate sort, the attention improves.
Wow.
So kids learn very early. Like, I had a little boy years and years ago who used to go to the bathroom all the time. When I went in to do the school visit, he only left the classroom when they were doing reading. So and when we evaluated him, of course, he had reading dysfunction, and it was a very easy correlation. But that idea of the behavior gives insight. So if you're dropping your pencil, if you're falling out of your chair, you look like you have ADHD, but it could be it's really stressful when you can't read and you're in school.
Wow, that was such a beautiful example. I'm so happy you explained that, and it's I think overarching in terms of us giving our children the support that they need on the area in which they struggle. It also help alleviate a bunch of other symptoms and behaviors. And of course, the message that we all like to enforce, that behavior is a way of communicating, and we just need to really.
Yeah, I would say the other issue that's really important is you can ask the kids, and if you stop and listen, they are very, very good about telling you. But it's very hard as an adult to sit back and just listen. So it's like, tell me about what's good in school. And they say, like, I love science, and they all love recess. I love recess. And you say something about, well, what isn't so much fun? And a lot of times they will be very forthcoming in saying, well, I don't like when we read. And you go from there. Some kids will also give you great detail. Like I have patients in my office who will say, I love when the teacher reads, but I don't want to be called on to read. I'm happy reading my book, following along, but don't call on me because that makes me so nervous then I can't read. So we need to listen to our kids so much more closely and think about kid language. Like kid language is global. And, it can be as specific in a way as they dislike the morning because the morning is when ELA, the language arts happens, or they love the afternoon because that's when science happens.
Wow, I love this conversation. So I wonder, Dr. Sprouse, do you have a recommendation for the parents in terms of successfully raising children that have dyslexia? What can a family do once there is the diagnosis in terms of creating equal opportunities for their child? Let's say a child struggles with reading. Do you let them listen to audiobooks, or do you kind of force them to read so they improve with that? What's your take about that?
Yeah, that's a great question as well. So I always say I don't want to force anybody to do anything because I hate being forced. And as a kid, I felt the same way. I see it as a dual program. If you're struggling with reading, then you break down the reading. So maybe they read one line and you read two lines. But then you have fun reading where they don't read anything and you're reading at their intellectual capabilities, not their reading level. So like, that then feeds their hunger and their curiosity for concepts, but doesn't overwhelm them because the reading is so hard. And yes, I would say all of our kids with dyslexia are on audiobooks if it's their choice by middle school, particularly for English and the language arts, because, it is hard to read fiction with these long flowery sentences. The boys and the girls just are overwhelmed. So the audiobooks, and sometimes we'll say to the kids, would you like to look and listen? Sometimes they just want to listen. Sometimes they want to look and listen because they can archive the word. I think we go with the accommodation that makes reading the least painful and the most successful, always. And that's true of any kind of learning disability. I mean, there's no fun in going to school 6-8 hours a day and suffering. That's just not going to work. So if we want to decrease frustration and increase success, we've got to really configure it in a way that's challenging for schools, but they can and will do it.
Dr. Sprouse, just before we kind of wrap the episode, I wanted to ask if you have any other comments or any other thoughts that you would like to share with our audience.
So one of the things I think people need to know, there's many good reading programs like Orton, Gillingham, and Wilson. But as a part of any reading program, not only do you want to know the cause of the reading, I also suggest to parents that they get very good eye evaluations to make sure that visual tracking is intact. Because we have many kids that read from upper left corner to lower right corner. They read on a diagonal line and their comprehension is affected. And that's very easily addressed, right? You can cover the rest of the page. You can have a variety of markers that make it easy. So I think the most important point is to say over and over, reading is hard, but we know you're smart and we know you're trying really hard, because they are. And if you say that, then that's the message that's going to get better and better, because their brains are going to grow. And as their brains grow, function will improve. And the degree will be up to the kiddo and his brain.
Wow. Dr. Samango-Sprouse, I want to A, thank you for all the information you shared with us, and B, thank you for doing your work with so much love and attention to the ability rather than the disability. And I hope that parents won't hesitate to ping us at info@oneinsixsupport.org if they have any questions for Dr. Sprouse, or visit the Focus Foundation website, and then they can communicate and touch base with Dr. Sprouse directly. Thank you again for your time, and we'll see you hopefully next time.
Anyway, it's good to see you. Always take care. Have a good week.
For more information, please go to www.twomomsnofluff.com. Thank you.
If you like this podcast, please subscribe and give it a 5-star rating so more people can hear it. Thank you.